Hello, everyone, and welcome. My name is Jill Risley, and I'm the Deputy CEO here at Infrastructure Victoria. I'm really excited to join you for today's webinar to discuss the findings of our co-authored research report from Infrastructure Victoria and VACCHO, the Victorian Aboriginal Community Controlled Health Organisation. The report was titled Investing in Aboriginal Health and Wellbeing Infrastructure, Securing Safe and Sustainable Community-Controlled Care. Firstly, I'd like to acknowledge the traditional owners of country throughout Victoria and recognise their continuing connection to lands, waters and communities. I pay my respects to elders both past and present. I'm joined here today by Dr. Jonathan Spear, CEO of Infrastructure Victoria,
Hello.
and Dr. Jill Gallagher AO, CEO of VACCHO, and they'll take you through the findings of the report. But first, a couple of housekeeping items before I hand over to Jonathan and Jill. There's an opportunity at the end of the presentation for you to ask questions. You can submit questions using Slido, and the link to that can be found underneath the live stream on our website. You can also view the webinar with closed captions by finding a link below the live stream on our webinar as well. Jonathan, I'll hand over to you to take us through the findings of the report before I return with some questions.
Great. Thank you very much, Jill Risley. And it's my pleasure to be here with Jill Gallagher today. And as this research has been a partnership as we've been doing it, it'll also be a partnership as we talk through this webinar and explain the findings of the research and its implications. So you'll get some tag teaming between Jill Gallagher and I as we go through this presentation. And that is entirely appropriate. We started this work over a year ago, really because Infrastructure Victoria's research program had identified that the health outcomes that Aboriginal people have in Victoria and Torres Strait Islander people in Victoria are poor and in many indications are getting worse as well. And we identified that there's 57 measures that relate to Aboriginal health and wellbeing services and the outcomes that are tracked through the Aboriginal Affairs framework, which have got a really helpful data dashboard. And many of those indicators show a widening gap in health and wellbeing outcomes for Aboriginal Victorians compared to other Victorians, and only 21 of them are experiencing improvement, and in many cases data marginal. And these are really significant negative outcomes in some instances in terms of premature births, hospitalisation for self-harm, but also not as highly regarded and rated self-reporting for health and wellbeing outcomes that Aboriginal and Torres Strait Islander people have. So those are some of the results that we were really interested in diving into and working with VACCHO and looking at, well, what is the role of infrastructure in helping to turn some of those results around? And we were really interested and impressed by the model of Aboriginal community health that exists in Victoria, but also aware that the infrastructure underpinning that isn't what it could be. And so I think that's a really good spot to then hand over to you, Jill, to take us through a bit more about the role that Aboriginal community health organisations have and the unique model that they deliver.
Thank you, Jonathan, and welcome to everyone. I want to tell you in this slide a little bit about what an ACCO is. What is an Aboriginal Community Controlled Organisation? An ACCO is an Aboriginal Community Controlled Organisation. For the purpose of this report, we've shortened it down to ACCO to refer to the health and wellbeing ACCOs, and specifically to the 33 organisations that are members of VACCHO. So ACCOs, what are they? They are independents. They are Aboriginal community owned and Aboriginal community controlled. They are answerable to their community, and the community decide what services that are needed. They are effective in supporting the individual and also the families, and as a whole, the community. Health and wellbeing ACCOs provide multiple services under the one umbrella. And those services are wrapped up with cultural care for every stage of life. A one-stop service shop, so to speak, that helps keep our people, the Aboriginal and the Aboriginal and Torres Strait Islander people, out of hospital, which in turn helps hospitals. ACCOs are integrated healthcare services with social services such as they also offer childcare, family services, aged care, both residential and aged care packages in the home, disability services, cultural services, housing and financial relief. ACCOs help community to navigate multiple mainstream systems and significantly eases their burden. ACCOs can provide healthcare while directly addressing the social determinants of health and the outcomes from that. Jonathan, if we can go to the next slide, that would be amazing. This is just a quick snapshot of, this is a model, the model that I've just spoke about, that looks at that holistic care. Over more than 50 years, ACCOs have provided a place where health and wellbeing of Aboriginal and Torres Strait Islander people can be restored. So that's just one example. Next slide, thank you, Jonathan. We know that ACCOs deliver better outcomes for our own people. And these stats highlight some of the good examples. You can read them, I'm not going to go through them. We believe the key is the dedicated teams at ACCOs who apply Aboriginal knowledge, culture and innovation to strengthen families, which in turn transforms lives. Importantly for government, health and wellbeing ACCOs help to reduce the number of people attending hospitals when it's unnecessarily. The Aboriginal population, it is growing almost twice as fast as the non-Aboriginal population. Providing these services through ACCOs will become even more important. ACCOs are already seeing the demand for services increasing with the population growth, and they need the most important infrastructure investments to help address a lot of that demand. Next slide, thank you. We know the Victorian Government recognises the effectiveness of the ACCO sector in its efforts towards closing that life expectancy gap between Aboriginal Victorians and non-Aboriginal Victorians. In 2022, we worked with government through the Aboriginal Health and Wellbeing Partnership Forum to achieve a health system that is safer and more effective for Aboriginal people to access. The Cabinet actually endorsed that action plan that followed, set out the actionable steps needed to make proper progress. While some actions has been taken, which we'll talk about a little bit later, further progress on these action items, they are unfunded. Meaningful progress will store without, and this is an important statement, meaningful progress will store without additional funding from governments. Next slide, please, Jonathan. This map just gives you an idea where the ACCOs are situated, right across the state of Victoria. So when we talk about business cases, we talk about the development for our members throughout Victoria. VACCHO commissioned a comprehensive assessment of ACCO assets. 31 of our 33 ACCOs across the state of Victoria took part. 200 buildings were looked at on assets. 30 non-building assets were looked at, like car parks, seed sheds, and the list goes on. Of those 200 buildings, 140 of them are owned by the ACCO. One of the key insights from the assessments is about the age of our buildings. The average age of the buildings that we assess is 40 years old. 17 buildings are more than 100 years old. One of our ACCOs is 174 years old. These are old buildings and they are deteriorating, in some cases very rapidly. We need funding to halt the decline and get our buildings in shape to support their Aboriginal communities, not only for now, but for in the future. That's enough from me right now, but I'm going to come back to you later on. So I'll hand you back to Jonathan to take us through a few more of the report.
Great. Thank you very much, Jill. So you've got then a sense from Jill about the way in which the ACCO sector is structured and operates, and the very effective model of delivery of multiple services to address some of these quite challenging health and wellbeing outcomes that we're seeing as we seek to close that gap in outcomes. What we looked at then in more detail is, well, what is the state of the infrastructure that underpins that? And I think Jill's already given you some spoilers on this, that we've got some really quite poorly maintained and in many cases just not quite suitable infrastructure to underpin this otherwise really very promising and effective service. And we know that the infrastructure affects service delivery and it affects client experiences. Of course, the outcomes we have are also around the service that's delivered in this infrastructure and the dedicated team and the way in which it is connected to the Aboriginal communities. But the infrastructure definitely affects the availability and the quantity and the quality and the cost of delivering those services. And what we are seeing is evidence that the ability for ACCOs to deliver efficient and effective services gets degraded by the low quality infrastructure that they are operating in. And many of the buildings, where they're old, they're dilapidated, they're often gifted for other purposes originally, like old school portables or homes or former colonial buildings. And frankly, they're in a condition that most Victorians wouldn't put up with. But we've got the people working in ACCOs and the communities who use them having to put up with this and working with these very dedicated staff. But of course, that makes it much more difficult for that staff to be attracted and to work in their job and to stay in those jobs. And we hear that directly from the people who are running those services and the GPs and the CEOs who tell us about that. And we'll come to some other case studies later on. But moving to some of the data that underpins this, there was an infrastructure asset assessment undertaken by VACCHO with the funding provided by the Department of Health. And that also found that beyond those anecdotal experiences and the case studies, when you look across the whole portfolio of buildings that ACCOs hold, many of them are unfit and deteriorating and reaching near the end of their life. Around 42% of them have floor area that really is in a critical condition when the asset and engineering assessments are done. And because these buildings are so old, when you look forward over the next 15 years, that number turns to probably over 80% of the floor space is going to be in very poor condition. And the estimate of looking across all those assets that Jill is describing, so there's around 220 of these different assets that the ACCOs hold, around half of them are already being assessed at the end of their economic life. And this isn't just peeling paint. This is not just minor cracks in the floor or the walls. In many instances, they're structural problems or things in the substructure, or the walls and the roof having holes in them and leaking. And that poses not only discomfort, but in some instances, danger to staff and clients, and has had to result in some of these facilities actually being closed. One example of that is the Dandenong District Aboriginal Cooperative Limited, isn't it, Jill? Where it's a poster child in a negative way about what happens when we have ACCO infrastructure that is old and dilapidated and isn't funded to be maintained. And with that, I might hand back to you, Jill, to talk us a bit through what's happened at DACCO.
This report includes a case study, and the case study is the Dandenong District Aboriginal Cooperative. We call it VACCHO. That has been the focus of intense advocacy for the last 3 years. Politicians at all levels of government have visited VACCHO. And we're still, 3 years later, still trying to advocate for some infrastructure resources. The VACCHO services 9 LGAs. That is also one of the fastest growing Aboriginal communities in Victoria. The VACCHO has been aware of the urgent need of upgrade and repairs of their facilities for over a decade. Now, before we had to shut it down, the front door would no longer open. Weatherboards were falling off. And whenever it rained outside, it also rained inside. Now, this is a service that deals with a lot of vulnerable families, including children. So in August last year, as the foundations failed even further, the cracks in the walls opened up and the risk of asbestos exposure became too great. The DACCO was forced to close the building. Since then, VACCHO and the DACCO have been working with government at all levels to find a solution that now requires further investments for a temporary emergency solution and an interim, and then we need to look at interim and long-term solutions. Our other members passed a motion, so the 33 Aboriginal ACCOs around the state came together at the DACCO site before we shut it and said, no, this is a priority. We will put our infrastructure needs above on the line and support the DACCO being a top priority for Victoria. And this is very good, because the situation that DACCO is in will be repeated around the states without action from government and the dedicated infrastructure investment. VACCHO and DACCO remain hopeful that this year's budget bid is successful and DACCO can secure a more certain future. Next slide, please, Jonathan. And before I go on to the next slide, I just need to reinforce that the 9 LGAs that the DACCO service, a lot of those areas also have the highest number of Aboriginal children in out-of-home care. So it's a high need areas, and this service is vital for our communities. But another important aspect of the ageing buildings is the energy efficiency of those buildings. So the energy audits funded by VHBA identified opportunities for ACCOs to save 3.1 million a year on energy costs. These savings could be reinvested in frontline services. VHBA are now investing 2.5 million to start these works, but a total of 18.4 is needed to reach full savings. So next slide, thank you, Jonathan. One of the most important aspects to the work that has been done so far is the work on cultural safety. Now, cultural safety of the building, not cultural safety of the services, there's a difference. So the building designs, like a lot of the buildings that we assessed are all hand-me-down buildings that either governments didn't want or local governments or churches, and of course were donated, or a lot of our members had to purchase them. So they were already pretty run down and weren't culturally safe. So what I mean by that, so in our service, the importance of the Aboriginal community control health and wellbeing model is not only the services that we provide need to be wrapped in culture, but so does the infrastructure need to be wrapped in culture. For example, usually a lot of our organisations don't just treat the individual, they treat the whole family. So our waiting rooms are needed to be a lot bigger for those appointments. Connection to outdoors, the importance of being, the waiting areas or that whole facility, but having a connection to the outdoors is very important. And that's that spiritual connection to country. And that's where all that stems from. The natural elements need to be embedded in the design, such as water, fire, and we also need to take into account men and women's business. So in our culture, that's very vital to separate men's business from women's business. And so a lot of our services, because they are not purposely built, do not have the cultural safety of the building design that they can play with. 160 of 163 buildings assessed scored below 3 on a 5-point scale, indicating them culturally unsafe for visitors and staff. But I just wanted to point out that the low scores do not reflect the cultural safety of the organisation or their services. This is why our members want and need purpose-built facilities. And I'll just give it, before I hand over to Jonathan, I'll just give you one of our services here in Melbourne actually have an OH&S safe open fireplace. That when you're in the waiting room, you're not only catching up with mob and friends and you're also in the winter standing around this fireplace and seeing the fire, and that brings well-being to us also. So I'll now hand over to Jonathan. Thank you.
Thanks, Jill. And yeah, it's really interesting when you layer on some of the physical conditions of that infrastructure, and that I was talking about earlier, the energy efficiency issues and the cultural safety issues, and that all starts to really add up. One of the other challenges that the research has found is the difficulties in sourcing sufficient funding that actually is directed towards building and maintaining the infrastructure that underpins the great services that ACCO provides. And so we have looked across all the different funding bodies who deliver funds to ACCOs, and we found at least 24 of them at state, local and national level. And most of that funding streams take as an assumption that there is an existing infrastructure that is being built and maintained to support the services that they're funding. And only 5 funding bodies actually provide funding for infrastructure, and those are very consistently oversubscribed and insufficient to really meet the task that is needed when you look across the age of this portfolio of infrastructure that the ACCOs hold. And so that means that we've got a structural challenge in terms of the funding approaches that are being taken to ACCOs, because it fails to take into account what really is needed for maintaining and renewing the infrastructure from which they are operating. The other thing we were really struck by when we were doing our research is the consistency of the findings that IV and VACCHO's research had with previous reports by others. In particular, the National Productivity Commission did its Closing the Gap review some years ago, and it found very similar things around the lack of funding and support ACCOs to build their organisational capacity to plan and maintain their infrastructure, the failure to cover the full cost of service provision, which includes that infrastructure cost, the often very heavy burden of accountability and reporting that is required back to funding partners, which is often quite duplicative but has a heavy administrative burden. And on the other side of it, a relatively low level of longer run consistency of funding so that planning can be done over multiple years and with a degree of self-determination on the part of the communities that the ACCOs are supporting. So all of that then takes us to the recommendations that are in this research. And I might say there were similar recommendations are in the recently released draft of Infrastructure Victoria's 30-year infrastructure strategy that has been out for consultation over the last couple of months. There's 3 recommendations in this research that Infrastructure Victoria is backing on the basis of the research that and evidence that we've been able to look at in partnership with VACCHO and other stakeholders. The first one looks at the ongoing ability to develop the skills and capacity of ACCOs to plan and deliver and further develop the infrastructure they need in a self-determined way. And the self-determined part of this is really important because, of course, they're Aboriginal community-controlled organisations. We know that part of the commitments that are being made under treaty and under Closing the Gap, and this in Victoria, but also many other places, is to progress the degree to which Aboriginal communities have a say in the infrastructure that they need, and ACCO is a really good example of that. So this research is calling for between $4 and $6 million each year over the next 5 years or so to build the capacity of health and wellbeing ACCOs to manage and plan their infrastructure in a self-determined way. And this would go towards things like staff in the ACCOs themselves, in not just in Jill's organisation, but in other ACCOs as well across the state, and also some of the specialist consultancy support that's needed to plan and support the delivery of infrastructure projects. The second recommendation we made really comes towards addressing some of those really challenging immediate asset maintenance issues that we had Jill describing, the DACCO example, and also the other data we have across the condition of the assets across all that the ACCOs are holding. And given that really poor condition, we're recommending that interim fund for minor works and repairs be established. And this might be ahead of a mooted perpetual self-determination fund, which may be an outcome of the ongoing treaty discussions. But that's not a reason to wait to address what are obviously really pressing challenges like the examples that Jill was describing. So we're recommending $30 million of funding each year over the next 5 years or so for ACCOs to really address those most urgent repairs that are needed. It won't address all of the repairs that are needed across a state of infrastructure like our asset audit has found, but it would certainly help keep them going and stop situations like the DACCO situation being repeated, where they have to close down and cease their services to the community or restrict them. The third recommendation that we've made is to fund more major capital works for health and wellbeing ACCOs. And this looks at between $100 and $150 million being invested to be able to start some projects over the next 5 years that really are focused on the highest priority renewals and building of new ACCO infrastructure where it is most needed. And of course, that's something we're recommending be self-determined across the ACCO sector. That really then takes us beyond that immediate support of maintaining existing assets and the very essential upgrades to actually reflecting that many of these assets are getting to the end of their useful life. Some of them are there already, and many of them are heading that way. And so we need to start to plan now to refresh and renew those assets, particularly if we're going to close the gap. And as Jill was describing, the Aboriginal population in Victoria is actually growing at a faster rate than the rest of the Victorian population. And so we need to be planning for that in terms of the ACCO infrastructure that we're going to need for that growing community. So that's a really important recommendation. And so when you think across the three of those, there's one about building capacity, there's one around meeting the most immediate urgent repair needs, and then there's this one around planning for and starting to invest in the most important upgrades and new infrastructure that we're going to need to continue what is a very effective model of Aboriginal community health services in Victoria. So that gives you a good summary, I hope, of the findings of this report, why the recommendations are in there, and also the great partnership that we've seen between Infrastructure Victoria as the state's independent infrastructure advisor and VACCHO, the peak body across the Aboriginal community controlled health sector. We've really enjoyed working with Jill and her team. We were really pleased by the very positive reception that this research had when it was released a few weeks ago. You might have seen Jill starring in some TV and radio interviews. And so now I'm really looking forward to handing back to Jill Risley, who's going to field some of your questions. And you can see some of Jill Gallagher's amazing talent. But really looking forward to expanding on that presentation and answering your questions. So back to you, Jill Risley.
Thanks, Jonathan, and thanks to you and Jill for that presentation and taking us through that research. We've got a few questions here, which I'll put to you from our guests. A reminder to those joining us on the webinar that you can ask questions. You can submit them through the Slido poll, which is found below the live stream on our website. So, Jill, the first question's for you. And you really articulated very clearly that the very dire state of some of the infrastructure across the state. The question we've got is, how does VACCHO think the investment should be prioritised, particularly in a self-determined way?
Well, basically, the highest level of need. And we've already done that with the VACCHO and our 32 other members who came together and says, the VACCHO is a priority. We need proper infrastructure for the VACCHO. But going forward, because we've done all those building assessments, we know which ones are in dire straits and which ones can hang on a bit more. But eventually, if we don't deal with them all, we'll have more DACCOs. So we've got the data and the evidence there of all our members and their infrastructure needs.
Thanks, Jill. Jonathan, a question for you. I know Infrastructure Victoria was really proud of this research and our partnership with VACCHO, but this is quite unusual for Infrastructure Victoria to co-author a report and the research. So there's a question here just asking, can you talk about how Infrastructure Victoria and VACCHO approach the process and any insights that you have from our partnership and from the process?
Yeah, really happy to, Jill. You're right. This is, well, not only is it unusual, it's actually the first time that Infrastructure Victoria has co-authored a piece of work. We take our role as the independent infrastructure advisor very seriously. We think that independence is something that we need to really garner, because people can trust us as an authoritative institution because of our independence. And I would hope also because of the rigour of the work we do, the quality of the evidence and the transparency. Having said all that, when we had identified that there may well be some pressing infrastructure needs in the ACCO sector, we were really conscious that traditional ways of working in government, where you don't necessarily allow First Nations people to really have a strong hand and a self-determined hand in developing policy and strategy, that's a real challenge. And we oughtn't go about repeating the mistakes of the past of coming and telling First Nations people what was good for them. We were really conscious that if we were going to do this work, we should do it in a way that reflected the spirit of progressing self-determination. And we're doing that across a range of Infrastructure Victoria's work. We have a reconciliation action plan. We have a number of objectives in our 30-year strategy that really try to get practical about what is the role that infrastructure can have in progressing self-determination and meeting the infrastructure needs of Aboriginal and Torres Strait Islander Victorians. So that was the context where we went, well, we're going to actually take a different approach to this work and work in true partnership with VACCHO. And we did it under a memorandum of understanding. There was a sort of formal agreement about what role each partner would have, and that reflected the important different contributions and different skills and evidence base and approaches that both organisations could bring to the table. And it meant that we scoped the work together. The work was authored across both teams, the evidence base. VACCHO had some great evidence base that we wouldn't have had access to otherwise. They had insights that we wouldn't have had access to. And it really just proves the point that if we had done this on our own because we were only valuing the independence of IV, we wouldn't have had a result that was as strong or as informed by the really insightful views from VACCHO and, of course, its members. And this research and the final report is one that was signed off by both Jill and I, but also by our boards. And so that partnership went all through the sort of the development of the project, how we executed it and the governance of it, and when it was released and communicated. I think the other lesson I would take, though, is, of course, doing it in this way takes longer. And, we work at a fairly rapid pace at IV, and we were really conscious that just driving through to hit a timeline is all very well, but actually working in partnership with other people takes longer, and that's fine. You need to prepare for that because you get a better result in the end. The other thing was the value of relationships. So, we developed relationships over a period of several years with Jill and her team and the project teams. And that's really important too, because if I was Jill and someone rocked up and said, "Oh, hi, we want to do this work and we start tomorrow," I'd probably be a bit reticent too. So, of course, it's around governance. Of course, it's around having clear responsibilities and really great culture of partnership, but it's also about having a long-run relationship where we take the time to invest in understanding where each organisation is coming from. But actually, that's my perspective. Maybe Jill Gallagher, I should ask you what you think and how you found that partnership.
Oh, okay. Well, Jonathan, look, can I say I echo everything that you've said. And the two organisations that come together, there was mutual respect and mutual understanding of some of the challenges you might face and some of the challenges I might face with this partnership. But VACCHO very early on knew that we brought to the table a lot of expertise in this space. And we brought to the table different expertise, the knowledge and understanding of our communities and what the needs are, and the work we've done prior to that. So I think I'm very, very privileged to have partnered with Infrastructure Victoria. So thank you.
Thanks, Jill. We've got a question here around the fiscally constrained environment that we find ourselves here in Victoria. So a question for you both. Jonathan, I'll hand it to you first, but Jill would love your insights as well. In a fiscally constrained environment where there are competing interests across the health system, where does VACCHO and IV see non-traditional partnership opportunities emerging across its stakeholder and or asset base to support asset redevelopment? So really a question there around the emerging opportunities of partnering.
Yeah, well, I'm happy to start. I'm sure Jill's got some views as well. So what struck me as we were doing this work is that the model that the ACCOs deploy is very effective. And while sometimes there's some frustration about efforts to close the gap across all sorts of different domains and across all jurisdictions in Australia, this is an example where we've got clear challenges in closing the gap in health and wellbeing outcomes and a model that works, like indisputably works, that the results that the ACCO model delivers is clearly superior to mainstream services. So why wouldn't we be investing and supporting in that more? And when I look at then how much we've identified needs to be invested, it's really pretty modest. So there's billions of dollars invested in the health system every year in infrastructure and services in Victoria and across Australia. And there's billions of dollars of poor health outcomes that translate into poor economic outcomes if we don't address that. So opportunities to support the continued operation of things like the ACCO model and to continue to expand it in partnership with other elements of the health system to meet the growing needs of the Aboriginal community, which is growing in number, seems to me like a really obvious choice to make in terms of where do you invest relatively scarce financial resources. Again, I think it'd be great to hear Jill on this. You've worked in this sector for decades, Jill, so I'm sure you've got some perspectives on this.
Thank you, Jonathan. I do. We do acknowledge that we are fiscally environment. We hear it every day, and there's no rest from that. I think we need to think about the ACCO sector has been neglected for many, many years. The oldest ACCO in Victoria is VACCHO, which is 50 years old. Neither state nor Commonwealth government have taken responsibility over those 50 years for our infrastructure needs. It's always slow-going, and we will be happy. And some of the hand-me-down buildings that our services operate as, they've been passed on, and already they're outdated. So no one has invested in our sector since the very first ACCO that was established here in Victoria. So that's one thing. Second thing is, yes, it is a tight fiscal environment, but if you look at the service model that we provide, it goes across a number of government departments, not just the Department of Health. If you split that up across all of state government and then bring Commonwealth into the space also, it's not a lot of money, really, with what the recommendations are asking for. So the money that has already been highlighted is just to fix the current need. It's and that's really important. So I don't see it as a lot of money, and I see if you share that responsibility across, I don't know how many government departments in Victoria, off the top of my head, I'm not going to sit here and count them, but if you share it across, because every government department funds an ACCO. So it's not just one government department's responsibility. And we, as Aboriginal organisations, get sick and tired, especially the service delivery organisations, not so much VACCHO, sick and tired of being used as a political football. Commonwealth say it's a state government responsibility. State government says, no, it's a Commonwealth responsibility. And we're stuck in the middle, and we end up with 33 deductibles if we're not careful. And that gap not being closed.
Thanks, Jill. One of the there's a couple of questions here, but also some comments thanking you, Jill, for such great description and articulation around the importance of cultural safety in buildings, which is a new concept to some people who aren't familiar with that and the importance of that. There's a question here around how do you make an existing ACCO building culturally safe, and what are the consequences of having culturally unsafe buildings on service delivery?
Okay, so first of all, how do you make them culturally safe? With great difficulty and great expense. Whereas if they were purpose-built, then it wouldn't be great difficulty, or in the long run, it would save a lot of money. The more we band-aid things, the more we end up with a deductible. And that's what happened over many years with deductible. Small grants, and we'll put a band-aid on it. Even 3 years ago, state government offered them $300,000 to upgrade their kitchen. And so they thought, oh, okay, at least we'll have a decent kitchen. And what happened was the tradies came in to upgrade the kitchen, the builders, and the builder said, sorry, we can't touch this building at all. It will fall down on us. So that $300,000 had to go back. It couldn't be used. So I really think you can in some cases, but it's done better if it's purpose built. So that was the first part of the question: is can you make them culture? You can to a degree, but there's so much you can do with something hand down. Anyways, the second part was, I can't remember, what was it?
There's a question on the consequences. So for clients, the consequence of having culturally unsafe buildings?
Look, the consequences is that it's around your mental health and your well-being. If you're an Aboriginal person accessing an ACCO, that is not, from a building perspective, culturally safe, don't have access to appropriate waiting rooms. You can't do men's and women's business. So that impacts on our well-being. Have access to outdoors. I mean, spiritually, fire and water is part of our connection to land. So it's all around your well-being as an individual and strong in your culture, and you see that reflected in the buildings that you have to enter.
Thanks, Jill. Really important concept that I know many people haven't considered in a normal service delivery environment. So we've probably got time for a couple more questions. There's a question here. Has there been any thought given on how ACCOs fit into and interact with the new health networks that will come online in July 2025? And Jill, I'll throw that one over to you.
I think it's an issue, by the way. We often talk about the importance of co-designing. And in this case, with Infrastructure Victoria, it was true co-design. We felt like an equal partner. So that's the difference there. But from a designing something from a government point of view, usually co-design usually works out to where government come with a plan already and say, what do you reckon? Will we do it this way? So, so the point that I'm trying to articulate without insulting anyone or upsetting anyone is that we haven't been engaged in a big way in relation to those facilities. And it's a bit sad that even today, when we have a partnership agreement with certain government departments, and we still are not engaged earlier on in the piece. So I can't answer it because I don't know.
Thanks, Jill. We're almost at time now. For everyone can see the contact details on the current slide for both VACCHO and Infrastructure Victoria. The full report is available on the Infrastructure Victoria website. For those who've participated in one of our webinars before, you'll know that there's a quick poll that pops up at the end of the webinar. It's really important for us in terms of getting feedback, and we incorporate that feedback into future webinars. A big thank you to Dr. Jill Gallagher, AO, the CEO of VACCHO, and Dr. Jonathan Spear, the CEO of Infrastructure Victoria, for the presentation and the insights today. We've got lots of wonderful feedback and questions and comments from the audience. So many thanks for that, and we'll leave it there. So for the audience, thank you very much for your participation today, and we'll see you next time.